Community of care teams typically focus on 3 big efforts. One of these is adopting a wraparound practice model. In this approach, a skilled facilitator will work with the youth and family to create a team of all the important people in their lives. System people, as well as the supportive people in their family and community. A coordinated plan of care is built with their input that capitalizes on the strengths of the youth and family and their vision. Ultimately, the experience moves from runaround to wraparound.
Wraparound is a way of working with kids and families that really acknowledges the underlying health in a person.
It's fundamentally a belief that people will make changes in their lives if a few essential things happen. One is if they're respected for who they are, if they're seen for the strengths that they have, and if they get their fundamental needs met. That when that happens, there's a belief that there's essential goodness in people, and that when you create an environment for that to grow, it will.
To me, wraparound is a concept to integrate services, and instead of the youth or the family member having to go through so many different organizations or channels to even get one resource, wraparound is supposed to bring everyone together, and the youth is supposed to drive that meeting.
It was like a family support, more as never really had a family support, so when I felt it, it was like I knew what it was. So it was definitely a family support, more as I got you.
In the past, services they've been dictated by probation, more or less, or by the agencies providing the services. Wraparound allows more self-direction, more participation. In the end, you might have a lot of the same services there, but you will have more family or community participation.
Wraparound is about families and youth having a very transparent and overt voice from the beginning in terms of what's happening in their worlds and what kind of treatment they're receiving.
Sometimes systems, right? Systems, there's laws, and then there's people that have to enforce the laws, right? And so oftentimes we, as adults, we focus on this is the law. But when you empower a kid and you allow them to tell their story, then all you're doing is listening to the solutions to their story because they have them.
When I started doing wraparound, one of the first families that I worked with was a 16, 17-year-old who had been on probation since he was 8 years old and had not been able to get out of probation because of a substance use problem that he primarily had. When we brought wraparound, we were able to bring the family, the different systems, probation, and another system that he was involved with, protective services, to the table, and he was able to define what his vision was. In other words, what he wanted his life to look like. And then we were able, with with the needs that he had, we were able to piece goals together, and then all of us at the table were able to help him reach that goal. So he was able to get out of probation, he was able to enroll into college, get a job, and get his own apartment, because he was able to tell us what he wanted his life to look like. We were able to get everybody at the table to talk and collaborate, and because we met regularly, making him the centerpiece of that meeting.
I think every youth, like myself, deserves a second chance and a change.
Learn more about how New Mexico communities of care can transform your community.